Hello and welcome. This is the first day of 2024 Construction Opioid Awareness Week. And this year we are kicking it off with a presentation entitled Naloxone on Every Job Site, Opioid Overdose Signs and How to Respond. It's a very important issue, a big issue within our industry. And, we're really excited to have this speaker here. We have Jeremy Gruber from Rescue One Training for Life. He's given this talk around the country at other construction companies, other businesses, other organizations. And KCA is thrilled to have him today. The way this works is after my comments here, I'm going to go off screen, let our presenter take it away. If you have questions, you can put them in the chat or raise your hand, and we'll field those questions. Or you could wait till the end and then ask your questions. But either way, we want to answer all your questions. But without further ado, take it away, Jeremy.
Hey, thanks very much for having us today, John. Jeremy Gruber here, founder of Rescue One. Got a little history with intranasal naloxone as a respiratory therapist and a paramedic. Worked for Montgomery County Fire Rescue outside of DC for 25 years, and then worked at several hospitals in the Baltimore and Washington area as a respiratory therapist. So happy to answer any questions. I believe we may have Dean Schutte on the line here as well, one of Rescue One's consultants who helps out with these programs and offers assistance in acquiring supplies and equipment related to this topic and other topics. So thanks for having us again, and we'll get started. Objectives, we're going to identify some common opioids, identify pertinent assessment findings before and after administration, recognize need for personal safety equipment and scene awareness, and then profile Narcan, or also called as naloxone, the indications, the contraindications, side effects, administration, dosages, mechanisms of the drug dosages, and signs when you recognize improvement. So most commonly used opioids are listed here. For different people's problems, they may be given a prescription for some opioids, which could be called hydrocodone or oxycodone, or Levrozole, Oxycontin, Tylenol number 3. You may get those as a prescription that comes in a form of a pill or liquid given by your physician that some people could get potentially addicted to. We have the others that might be from an overdose from or using drugs that are not prescribed, and that could be heroin or codeine or fentanyl or Dilaudid or methadone or other opiums. So whether it's prescribed and then abused, or whether it's gotten illicitly and used and abused, are the ways that people could become addicted and having an opioid problem. So natural opioids include morphine and codeine. So that's that's from natural sources. Semi-synthetic opioids, which are made in a way that they're synthetic, include oxycodone, hydrocodone, oxymorphone, so different ones. And then methadone is a synthetic opioid, usually categorized in a different category. Synthetic opioids, rather than methadone, include tramadol and fentanyl. And then heroin is where your illegally manufactured synthetic opioid is made from morphine. So that's how you get to where you get with that, the different opioid subcategories. So things to know about an overdose: naloxone and Narcan is only effective for an opioid overdose. It's not effective for any other type of drugs, but is very effective when it comes to opioids. Narcan has no effect for an overdose caused by a non-opioid drug or alcohol or anything like that. So it does not work with anything that is not an opioid. And those are cocaine, benzodiazepines such as Xanax, Klonopin, Valium, and methamphetamines or alcohol. Narcan is administered to a person dependent on opioids, can produce withdrawal symptoms, so you have to be very careful. when someone actually gets this in their system. If they're dependent on opioids, this can cause some pretty big problems to that individual, but we'll have to work through that as we go through this presentation. Withdrawal, although uncomfortable, is not usually life-threatening. So anytime you have somebody with an overdose, you do want to, initiate a 911 call to get some help. Depending on the nature and the severity of the overdose, we want to make sure that we get this person some help. Anyone that receives Narcan should probably be transported to a hospital by emergency medical services to evaluate their situation. Depending on what someone's gotten into, we want to be very careful monitoring the patient, because one dose may not allow for the person to have complete restoration of breathing for a period of time, only because it depends on what they got into and what type of opioid and the concentration of opioid in the actual drug. You got to be very careful, because sometimes it may take multiple doses of Narcan to help fix the problem, because the Narcan will wear off over a period of time. The half-life of it is about 10 to 15 minutes, and depending on the opioid that they've gotten into their system, it could cause for a long duration of cessation of depression and respiration. So depending on, what they're using, carfentanil are much stronger than your normal opioids. So depending on how it was acquired and what the actual opioid is, there may be a much longer period of time of cessation of respiration, and it may require multiple 4 milligram doses to assist. So you have to look at, location of job sites, how close EMS is, response times, to assist in allowing to know how much, Narcan one may want to have on a job site, and locations of keeping it on job sites or other places in the community or within a patient's domain where they're actually located. Signs of a serious opioid overdose. We look at breathing as a big piece of that. Someone who's breathing slow or shallow, less than 10 breaths per minute, which equals 1 breath every 6 seconds, or has stopped breathing. To recognize someone has a sign of a serious opioid overdose, it depends on when you came in and found them as to help determine what might be their problem. Obviously, someone could be in cardiac arrest. They could be unconscious and unresponsive and having shallow or no breathing. Looking at the whole situation, what are we finding ourselves dealing with? And we always want to have in the back of our mind that it could be an overdose of opioids, and we want to have that antidote of Narcan to assist, which could lead to a cardiac arrest if not recognized in time. So we want to make sure that we're looking at the whole situation, and if someone isn't breathing, that we're getting an AED, we're starting CPR, and then we're considering giving Narcan. Narcan won't hurt, but if there's any thought whatsoever of this person being in cardiac arrest or not breathing from an overdose, we want to definitely use the Narcan as quickly as possible, and then provide care, providing CPR, use of an AED, and potentially airway management with rescue breathing, depending on if you have a CPR mask or not. You want to be very careful if someone has any type of fentanyl or anything like on them, not to be touching it without body substance isolations, having gloves, and using some type of mask. So it could cause a secondary overdose on somebody else if you've gotten into uncut or some type of powdered substance that has the opioids in it. So, but in general, unless you see that or you're concerned about a large amount of opioids, you should be concerned, but not overly concerned. So someone may have blue or grayish lips on their, and also fingernails that look blue or grayish. Skin may turn gray and blue, and overall blue or gray. Hemoglobin. They may have constricted pupils. So that's another thing to look at is their eyes. If their eyes are pinpoint, look very constricted, that would be a good indication, along with depressed respirations, that they're suffering from an opioid overdose. So looking at the eyes, looking at pinpoint pupils, and a depressed respiration or no respirations, then you want to go ahead and consider using Narcan or naloxone at that time. Commonly called pinpoint pupils. Look for pupils in the picture here. You'll see 3 millimeter or less, 1 millimeter above the width of the inside of the dime. Okay, so that's a good picture, is what pinpoint pupils would look like. Signs of opioid overdose by themselves. Most previously listed signs are not a reason to give Narcan, but must have a reason to suspect an opioid overdose in conjunction with the signs listed. And then Narcan indicated only when opioid overdose suspected and the victim is unconscious. So that's when you want to give it. Reason to suspect an overdose, you see paraphernalia, potentially needles or syringes, or a charged spoon. Witness states the victim was taking some sort of opioid prior to the overdose. Known heroin user location. So we do want to use personal safety. Like I said before, body substance isolation is very important to protect you or any of the caregivers, with the use of personal protective equipment, potentially a mask, potentially gloves, and try not to touch any of fluids or powdered-like substances that you may come across. So if you think it's an IV drug user, you may want to be very careful of unsafe sharps in people's pockets as well. Narcotic patches may transfer medication to your skin if exposed for an extended period of time. So if they have a patch on and you're taking it off, just make sure you're not letting that touch your skin, and hopefully you're removing it with a gloved hand. Heat and moisture also increase transfer. Exercise caution while engaged in physical contact with the individual. So we have our Narcan. Typically, if you have a box, you have 2 doses. 4 milligrams intranasal Narcan spray is a single unit dose, which is shown in the picture. In that box, you typically have 2 4 milligram doses. When I was practicing as a paramedic full-time, we usually gave it IV, and now they've aerosolized it to make it so anyone can give out. So that's why Narcan has become so popular in the aerosolized version, because it allows for anybody to use it that has minimal training. So what Narcan is, or we also call it naloxone, it's a narcotic antagonist. It antagonizes effects of the opioid narcotic agents by competing for the receptor site, resulting in the reversal of respiratory depression associated with opioid overdoses. So basically, it tells the opioid to get off the receptor site and binds it, takes over the receptor site, and doesn't allow the narcotic to get on that receptor site to allow a depression in the consciousness and respiration. Indications to use it are an altered mental status in the presence of suspected narcotic overdose or coma of unknown etiology. So if you don't know what's going on and there's any indication, or you're not sure if it is an overdose, Narcan is not contraindicated. It would only be contraindicated whether there's hypersensitivity to the drug if it was known, and then in a neonatal setting for a small baby. Potential side effects are rapid administration cause projectile vomiting, patient may become agitated or violent after drug is administered. I've seen that some where someone comes out of the high that they wanted to have and they become a little belligerent because of you reversing it. So you want to make sure you keep some distance once you do give it. And it varies, but it could cause some withdrawal problems for chronic narcotic users. So this is just a picture showing how the naloxone binds with the receptor site and then allows for the narcotic to be kind of kicked off. So narcotics that are actually in place, the opioids in place, naloxone is that opioid antagonist, as we talked about, antagonizing effects of opioid narcotic agents by competing at the receptor site, resulting in reversal of the symptoms causing the respiratory depression from opioid overdoses. The half-life of Narcan is shorter than opioids, and depending on the opioid that has gotten into the system, is where the problem comes into place, because fentanyl has a much higher level duration that affects the patient. So that's where you may have to have multiple doses depending on what they've gotten into. The intranasal route is very quick and easy for anyone to administer. It can be sprayed in either nostril. The intranasal plunger colored red must be placed in the nostril and then depressed in hard and fast administers the sprays. So basically, you take your thumb and you push very fast and hard on the center of the back of the dispenser, and that'll allow for the atomizer to make it a very fine mist in the nose, and then the blood vessels allow the medication to get drawn into it and then get circulated through the body, and then it goes to the proper places to allow that antagonist effect to take place. So that's what's going on with that. And then there may be times that a second or third or fourth or fifth dose is needed. I've only heard of one time where one of my customers at a restaurant bar ended up having to use 5 doses on somebody. But it may take a few doses to do the reversal, but a lot of times 1 dose could do the trick, but it varies depending on what, like I said, what they got into. The patient initially responds to the medication and then reverts back to unconsciousness and breathing slowly. The patient does not improve from the first dose and remains unconscious and breathing slowly. That's where a second dose would be needed. So the slide here shows the overdose is suspected, non-responsive to stimuli. The breathing status is listed there. It could be normal or fast, slow, or no breathing. And then at that point, you want to go ahead and administer Narcan. Check responsiveness, not conscious or alert. Check breathing status. Must be slow or absent. Remember to check your ABCs, airway, breathing, and circulation. And if they are not breathing at all, you can use the Narcan, but also making sure you're getting an AED, because at that point, if they're in a arrhythmia that can be corrected with an AED, it is time to put the AED into use, depending on how far down this overdose has been going on and what effects it's had on the heart from being what the word is hypoxic, or a lack of oxygen for a period of time. So how to administer Narcan: you would take it out of its pack. As you can see in number 1, number 2, you're basically depressing the nozzle in the nose, already deployed in the nose, pushing it firm and allowing for the atomized mist to be deployed. Side effects: patient may become agitated or violent after Narcan is administered. Very rare, but it does happen, depending on whether it was an accidental overdose or it's an overdose because someone was trying to actually use it to get high. Maintain a safe distance, as we talk about. Rapid administration may cause vomiting, but that's just a side effect that you're gonna have to deal with. Make sure you try and consider body substance isolations, using gloves, using mask, and eye protection. So anywhere we have mucous membranes on your body, you want to try and protect to allow from anyone's stuff to get into your mucous membranes. May participate withdrawal in chronic narcotic use. So what you should see, each victim will respond differently, but most will wake up and simply be confused and disoriented. Side effects may include, but are not limited to, a rapid heart rate, nausea, vomiting, sweating, blurred vision, and the opioid withdrawal that we talked about, and occasionally can become combative. So making sure their hands are not in striking distance of your body, because they may come up swinging occasionally. So use extreme caution, obviously, with combative victims, making sure you're calling 911 prior to administration of the Narcan, and letting them know you are administering Narcan, if you can let them know that, if you think that's going to be a possibility. And having EMS kind of give you best guidance and letting them take over to allow for transport and any other things that need to happen within the EMS domain. Most victims will also be disoriented and confused for a period of time, may not listen to commands, depending on how much narcotic overdose they have going on. Every patient will be different. So signs for improvement: when the respiratory breathing returns, reverts from irregular, inadequate to normal breathing, circulation, pulse is present, normal, skin tone improves, so they're not going to be as gray or pale, hopefully some circulation, and breathing will allow for, an improved colorness of the skin and circulatory efforts. And they at some point become conscious and improves, the victim becomes more alert. So that'll take place over time. So we highly recommend, obviously, knowing CPR, because the end result, if they're in an overdose that's not corrected, is they're going to be in cardiac arrest and they will need CPR, compressions, chest compressions, and the use of an AED. Good compressions on the chest, a rate of 100 to 120, about 2 inches in deep for an adult patient, will allow for 100 to 120 compressions in a minute period of time. If you don't want to do rescue breathing, by doing good compressions, you allow for circulation of the blood. With the chest compression, you're exhaling air from their chest, and then when the chest recoils, air goes back in, which is at the room air of 21% oxygen. If we were doing rescue breathing, we'd only be giving 16%. So it's better to do chest compressions uninterrupted most of the times. The only problem you want to get into if someone drowned or someone choked, we do want to try and give breaths with a mask to allow the alveoli, or the lower parts of the airway, to open back up to allow for the gas exchange to take place. So making sure you're using a barrier device, provide rescue breathing if appropriate, and prevent potential contact reaction to the patient's opioid overdose. Consider the use of latex-free gloves and eye protection, which we talked about, to prevent contamination. This presentation is available for you to use. There's some resources between the Centers of Disease and the European Drug Union and the National Centers for Drug Abuse Statistics. If you need statistics or more information, these links are very good. We see here the amount of overdoses and trends over the last 20 years, and obviously it's increased dramatically. If you have any questions, this is my email address. I'm happy to open up the discussion to allow for questions to be asked.
Do we have any questions out there? Before we get to any questions, I just want to add that I saw Claire Bryant on the call from National Safety Council, and it was a good reminder for me to let people know that National Safety Council has tons of resources on this topic and a lot of other safety topics. But when it comes to overdose and workplace overdose especially, they have really good stuff, really good resources for employers and for workers. So I highly recommend checking out National Safety Council.
This is Seth Core. I have a question. I just wanted to clarify if you can use Narcan on a 9, 10-year-old, 11-year-old.
Absolutely, not a problem whatsoever.
Okay, it's just like an infant.
Yeah, we're talking a neonate, so we're talking really below the age of 1.
Okay. Thank you.
No problem at all.
Got a little chat. Something popped up. Oh, thanks, Claire. You're awesome. Claire just gave a thank you to Jeremy for the great presentation. And on behalf of KCA, thank you, Claire. Keep up the great work at National Safety Council.
I do have another question. This is Seth again.
Yes, Seth.
I know that there's been a lot of talk about in construction, not all sites have a job trailer, and how long can someone keep it in a hot or cold car?
That's a great question. So obviously everything degrades with extreme cold or heat. So you could actually put it in like a cooler, which allow the extremes of temperatures to be more regulated within a cooler. So it'll keep it to a more normal thermic temperature. So it's really look at placement. If you could put it in something that has thermal barrier, you're going to allow that drug to do much better. Even if it does get heated up or cooled down, it's still going to most likely work. But if you have the opportunity to protect it from the environmental temperature rate of zones that it gets into as very high or low, it would be better. So you really need to look at the box and just understand that it does have a temperature range. It would still most likely work, but if you can protect it ahead of time, you're going to be much better off. So, like I said, a small cooler marked, with naloxone or whatever, just so everyone knows where it's at. If it's going to be in really more high temperatures than low temperatures, but if you can protect it, it would be better than not protecting it.
That's a great idea. I never thought of just putting it in a cooler with no ice or anything. Just put it in the cooler.
Yeah, it just will protect it from extremes, one way
Thank
or
you.
the other. It keeps it more normothermic.
Thank you. I'll share that with people.
Sure. Yeah, absolutely.
Any other questions?
Now, John, I have a question for you.
Yeah, go ahead. Yeah.
Is there a way to get these for free?
Yes, there is. Yeah, I was going to close with that, but that's awesome. Thanks for asking, Seth.
Okay.
Our great partners, the state government, the health, I think it's the Department of Health. They supplied community groups like KCA with access to free Narcan. So KCA has plenty of Narcan on supply, and we're getting them out to job sites. This year, I don't know if you know this or not, but we recommended that every construction job site have Narcan on it, and every construction office have it. So we're equipped just in case the unthinkable, and if the worst happens, you'll be equipped and ready for it. Because in our industry, you never know what's going to happen. The unknowns happen every day. Unfortunately, this never happens, but if an overdose does happen, we'll be ready for it. But yeah, please reach out to the KCA if you would like some Narcan, and we'll ship it to you.
So one thing we also recommend is if you're gonna, have Narcan on the job site, which I highly recommend, is that you actually attach it into a container that lists what's in it. We have Narcan containers that you can attach to your AED. So if you're going to grab the Narcan, you should be grabbing the AED and other airway management equipment so that it allows for to be present with all the rest of the resuscitative equipment that would want to come to a job site patient, so that if there was the opportunity that allowed for the Narcan to be needed, but they're already into a cardiac event from the depressed respiratory situation, the AED would already be on site. So we make a backpack that has the AED, the Narcan, bleeding control, and first aid equipment all in one backpack. So that way you grab one bag and you have all to treat all your life threats. So when you're considering, your safety program, consider having this all in one, type of response bag. That way everything is on site with that victim at the time, and you don't have to go back and keep continuing getting equipment.
So you got that. Get your backpack from Rescue One. Get your life-saving materials together in the backpack, and then when you need Narcan or you need another one, just contact the KCA and we'll work together. It's one big industry. We're all in this together. We're all here to help each other. So.
Yeah, I'm not sure if Dean Schuette's online or not, but Dean can help anybody, or I can certainly help anybody. Just feel free to reach out and we'll be able to get you some information on that. And yeah, if you need any help with questions at any time, feel free to always give me a call. I'm here as a resource to KCA and mechanical contractors and all the other associations that we work with.
Awesome. Any other last questions? Well, on behalf of the Keystone Contractors Association, just like to thank Rescue One Training for Life for your partnership, and not only your partnership with us and the industry, but like your commitment to the industry and helping everyone. So keep up the great work, and I'm glad we've connected over the years. So thank you so much for today.
Oh, my pleasure. Be happy to assist with any of your needs when it comes to medical related first aid bleeding control type things. Be happy to help out. And it was great to meet everybody, and great questions, and thank you for your time. Hopefully provided some good information.
Awesome. Thank you. Have a great day, everyone.
Thank you.